Seriously, Tony, you aren't going to change the channel? A film about counterfeit medicine traffickers? That screenplay doesn't stand up to scrutiny.
What are you saying? I think this film's really realistic.
Look, it clearly shows gun running, drug trafficking, but counterfeit medicines? Really?
Max, you should watch the news sometimes. Listen, for example, the authorities in Angola seized 1.4 million packets of a counterfeit malaria medicine in June 2012. Counterfeit medicines don't contain any active ingredient at all. Don't you have an opinion about the impact of this counterfeiting? Years of fighting malaria could be put at risk because of this type of product on the market. More recently, in 2013, the American authorities published an alert about the illegal sale of diabetes medicines that were not only ineffective, but could also be dangerous to health. So will you always be in denial about the trafficking of counterfeit medicines?
Your examples are isolated cases. It's not to say that there is a great deal of trafficking going on.
Okay, bear with me. I'll show you. Give me time to do a bit of research. In itself, the counterfeiting discovered can be considered, but it's very difficult to obtain reliable data. However, the overall evolution around the world is worrying. Look, in the best of cases, counterfeit medicines hardly contain or don't contain any active principle. If that isn't a direct threat, then serious illness is. The sick person is in danger of not getting the treatment they need. It's also the case that taking counterfeit medicine is a danger to the patient's health. It could even be fatal. A fake vaccine has already caused the death of 2,500 people in Niger. 89 children in Haiti were killed by a counterfeit cough syrup. Counterfeiting is not a problem to be taken lightly.
But when you talk of counterfeit medicines, what does it involve exactly?
There are various terms not to be confused. Strictly speaking, counterfeiting is the action of reproducing intellectual property rights without the permission of its owner. For example, in the case of medicines, it concerns the identical copying of a medicine protected by a patent. Then you have falsification. Falsified medicines are counterfeit medicines that are passed off as authentic medicines, deceiving the patient in their composition, presentation, and origin. The term falsified medicine is better than counterfeit because it emphasizes the risks to public health involved. Lastly, the so-called substandard medicines that are authentic medicines but don't meet the quality specifications for it. They have usually had the active substance wrongly dosed. Of course, counterfeit and generic should not be confused. Generics are authorized copies of the original medicine legally containing the active principle because the patent of the reference medicine's active principle has come into the public domain.
I agree, but frankly, counterfeiting of medicines mainly affects poor countries, doesn't it?
It's a problem all over the world. The authorities seize them somewhere in the world every year. For example, the operation called Vice Grips 2 in Africa, led by the World Customs Organization and IRACM in 16 African ports in July 2012, intercepted more than 80 million pharmaceutical products in 3 days, worth about $40 million. Even more impressive is Operation Bayela in Africa, led by the World Customs Organization and IRACM in 23 African ports in April 2013. They intercepted more than 500 million pharmaceutical products in 10 days, worth about $275 million.
You only talk about figures for Africa. You live in Europe, in a westernized country. There's no risk.
Look, just a moment. Here are the figures from European customs. Of 114 million products seized in 2011, 27 million were counterfeit medicines. That's 1 product out of 4. Another example. The biggest seizure ever of counterfeit medicines by French customs and in the European Union took place in Le Havre in May 2013. The customs services seized nearly 1.2 million counterfeit sachets of aspirin from China concealed in a shipment of tea. The powder contained in the sachets was essentially composed of glucose. The merchandise was on its way for delivery to a Spanish company in the Balearic Islands, presenting all the aspects of a shell company. and were certainly going to be sold in the Iberian Peninsula, the south of France, and French-speaking Africa. It is the biggest seizure of counterfeit medicines ever made by French customs and the European Union.
All the same, I didn't think counterfeit medicines would generate so much traffic.
Unfortunately, yes, it must be said that it's very lucrative for the traffickers. Imagine, for $1,000 invested, the traffic in counterfeit currency or heroin brings in about $20,000, and counterfeit cigarettes $43,000. Counterfeiting medicines makes $200,000 to $450,000. So counterfeit medicines are 10 to 25 times more profitable than drug trafficking. You see, counterfeiting medicine is not a problem to be taken lightly.
I've got the message. Hey, about your computer. Lots of publicity for online pharmacies appear on the screen. These sites seem to be genuine and also inexpensive. Look at that pile there. I need to get it ready before going to the beach this summer, and what's more, it's great that I don't need to go to the pharmacy to buy it.
I wouldn't do that if I were you.
Why not?
Give me a minute. I'll show you. It's risky buying on the internet. That said, I know it's tempting. There's a very wide range of choice, and with the explosion in medical advice forums, there is a trend to choose our medicines without thinking about the medical case that can be dangerous when you haven't had any medical training. What's more, you can buy completely anonymously on the internet without being judged on the product you buy. And above all, the prices are often lower than at a pharmacy. But sites selling medicines online should not be trusted. In fact, 95% of the online pharmacies do so illegally. When you place an order on an internet site you aren't sure about, you've no guarantee about the quality of the medicines you're going to get. You don't have the benefit of any medical advice. It's impossible to check the conditions of transport or the traceability of the products you've bought. You can't check if the online payment system is truly secure, and there is no checking of the transaction or the nature of the products you're going to get. And to finish, the possession of counterfeit medicines is as illegal as their production and their sale.
Well, I suppose it's better for me not to buy anything then.
There's nothing to stop you buying on the internet, but it's better to ask yourself a few questions first. Is it legal to buy medicines on the internet without a prescription in your country? And if so, how do you know that the site you want to buy on is a legal pharmacy or not? If you've got any questions or any doubts, you should contact your National Health Service. For example, in France, the reference agency is ANSM, the French National Agency for Medicines and Health Product Safety, and in the United Kingdom, it's the MHRA, Medicines and Healthcare Products Regulatory Agency.
Even so, all these stories of counterfeiting are not very appealing. So you should ask yourself bluntly if it's better to stop taking these medicines.
Let's not exaggerate. Counterfeiting is a menace to be taken seriously, but fortunately there are ways of combating this problem. Actions to fully sensitize and mobilize countries have been taken internationally for quite a few years. For example, there's the Medicrime Convention among the more recent initiatives. Adopted by the European Council in December 2010, it's the first international instrument in criminal law obliging the signatory states to institute a penal offence. The manufacturing of counterfeit medical products, the supply, the offering and trafficking of counterfeit medical products, the falsification of documents, the unauthorized manufacturing and supplying of medicines and the marketing of medical devices that do not conform to requirements. Another example. A new European directive was validated by the European Parliament on the 8th of June 2011. This new directive strengthened the instruments in the fight against falsified medicines by making the distribution chain secure, especially on the internet. The 2011/62/EU directive particularly provides for the creation of a logo to identify websites of legal pharmacies, the creation of a system of product traceability, and stronger sanctions against traffickers. At the local level, health agencies, the police, and customs are constantly fighting counterfeiting. The results of Operation Pangaea are an example of how wide-ranging the work of these local actors is. Coordinated by Interpol, this operation in the fight against false medicines sold on the internet brings together the customs, health protection authorities, the national police and the private sector every year. In 2013, Operation Pangaea 6 inspected 534,000 parcels, of which 41,000 were seized and 10.1 million illegal counterfeit tablets were confiscated, worth an estimated total value of $36 million. 213 people were arrested or investigated, and nearly 13,700 websites were closed down. And also, if you look at a box of medicine, you will soon notice that there are a number of effective protective tools counteracting counterfeiting. There are 4 types of device. Inviolability systems, such as evidence of breaking and entering revealing any attempt to open it, thus prohibiting the substitution of its content and ensuring its integrity. Identification systems, such as barcodes, refer to the ability to differentiate the medical products from others in a batch. Traceability systems, such as data matrix, so that the product can be traced and located by a scan throughout the complete life cycle of the production and distribution processes. And lastly, authentication systems such as holograms, providing the certainty that a product is what it claims to be.
That is more reassuring. What's important is to be vigilant.
Exactly.
Tony?
Yes?
You know what? This film's not so bad.